helping make your life easier. Moms Every Day.
Thanks for staying with us for Moms Every Day, everyone. We're glad you're joining us. We have Dr. Joe DeLapa here with us today, and we're talking today about the Marshall Senior Pain and Wellness Center, especially when it comes to dealing with back pain, and we're talking about the causes and the treatments.
Right.
So they're at the facility. We want to talk to you about why particularly focus on seniors, why the focus on them.
Okay, well, thank you, Taylor, for having me.
Absolutely.
So the Marshall Senior Pain and Wellness Program is a brand new center through the Department of Family and Community Health at Marshall and an association with Cabell Huntington Hospital. And it's a brand new program, and the entire focus of this new program is to focus on senior citizens and the treatment of their pain, specifically back pain and joint pain.
Okay.
And as you may know, senior citizens are actually one of the fastest growing segments of the U.S. population. And that in association with the fact that back and joint pain are some of the main causes for people going to the doctor, it just sounds like a good association to make. And that was really the focus of this new practice. Over many years of practicing, I hear so many times, specifically senior citizens come to me and say, you know, I was fearful to go to a pain doctor because I was going to be placed on, you know, habit-forming medicine, addictive medicines. And being an interventional pain doctor, I really wanted to start something new to where I could say we offer actually more interventional and non-addictive treatment options for the treatment of pain, and that is something that this new program is all about.
Okay, doctor, when it comes to seniors, are they more susceptible to back and joint pain, you know, maybe than younger people are?
Yes, that's a good question. So actually, yes, that makes sense. I mean, if you think about it, I mean, unfortunately, as we age, we all develop wear and tear of our joints, such as the hip joints and actually some of the joints in the back and the discs, which are actually like the shock absorbers in the back. And those wear out over time. So that's one of the big causes. And unfortunately, senior citizens are more prone to that. But also the fact just other conditions, such as you know, as women develop postmenopausal periods, they also are more prone to things such as osteopenia and osteoporosis, which can actually contribute to back pain. And then just other things such as a decreased muscle mass, so the things that actually help stabilize the spine and joints and less activity, that also can contribute to chronic pain in general.
That's just the tough part about that aging process. You know, with that comes all these problems that we have to deal with. So, okay, we want to ask you too, because, you know, there are probably some causes of low back pain in people. So what are some of those common causes that you see that will cause this? Well,
and specifically for senior citizens, some of the more common causes for back pain are things such as arthritis, and specifically osteoarthritis, which is actually the most common form of arthritis. And arthritis really just means a degeneration of the joints and loss of cartilage. And in the low back, there are many joints that actually develop this arthritis, and it's really one of the main causes for just a chronic aching low back pain in senior citizens. And also what this leads to is a condition called stenosis. So I hear a lot of patients come to me and say, I was told I have stenosis or degenerative disc disease, and I try to educate patients on what this means, first of all. So stenosis basically is a narrowing of where some of the nerves and spinal cord regions are, and that can cause conditions such as sciatica, which you've probably heard of, and patients experience where they start to develop pain that radiates into the legs and makes it difficult for them to move around, to walk, and that's always a very uncomfortable situation. So those are some of the two most common, is the arthritis and the stenosis. But degenerative disc disease, which really is just a flattening of the discs in the back that occur over time. And then, as I mentioned earlier, unfortunately in older age you're more prone to softening of the bones, and this can cause conditions such as compression fractures, which can also lead to intense back pain from bone loss. So.
Before we go, real quick, what are some of the treatment options that are available for people out there who are dealing with this?
So I use a multidisciplinary approach to the treatment of pain, and what that means is, as an interventionalist, I use a lot of minimally invasive injection options for the treatment of pain, and we discuss those in great depth in our office. But also I like to focus on things such as physical therapy, non-addictive medicine options preferably, and other type of treatments that are less habit-forming.
Well, doctor, we appreciate you joining us today. Thank you so much. If you at home need more information, head over to WSAZ Mobile. Click on that Moms Every Day tab. You'll find this interview with the doctor there. Stay with us. We'll be right back.